You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, for those of you that are, if you're an adult on Medicare, then you have to watch today's program because we're discussing a new kind of experience for those people that are on Medicare. And with us, we have one of the clinic directors of Oak Street Health, Dr. Kendra Frazier. Dr. Frazier, welcome to the program.
Thank you for having me.
All right. Now, for people that don't know Oak Street, who's the typical patient and what is your role there?
So I have two roles over at Oak Street. One, I'm the regional medical director. What that means is that I manage the other physicians. I'm an active role in hiring physicians, making sure that they give excellent care to our patients. My other role is I'm a physician there myself. I work
a primary care physician, right?
Absolutely. Okay. Primary care, I actually specialize in geriatric care as well, which is perfect because our patient population is anyone that is on Medicare. If you are 65 and older, you probably have a Medicare card. If you're 70, if you're 80, you have Medicare. If you are disabled, you have Medicare, more than likely. And we always take anyone that has Medicare over at our clinics. If you're a patient that is dissatisfied with the care that you're currently receiving, I want you to come to Oak Street and just check us out. We'll tell you if you qualify. We'll tell you if you can be our patient there. Likely if you have Medicare, yes. Some people have Medicare and Medicaid. That's fine too. We take that as well.
Now at the top of the show, we said that Oak Street Health is a different kind of experience for primary care.
Absolutely.
And you say you spend more time with patients?
Yes.
Like twice as much time with patients?
Yes.
And I guess you guys are reimbursed based on keeping people healthy and well. Elaborate on that. I mean, how are you really different?
I love to hear you say that because a lot of times people go to the doctor when they're sick, when they're not feeling well. And that's not our goal. We want to keep you healthy. That is the primary objective of Oak Street Health. So I want patients to come in, even though they're feeling well, come see us, come check us out. It's still about building a relationship with your physician, and we have the time to do that. A lot of places you may have 20 minutes in the office, and that's not even a full 20 minutes with your doctor. At Oak Street, you spend 20 minutes with your physician. Our first visit can be up to 2 hours long, and that's meeting everybody, helping you deal with your insurance matters, seeing our medical assistant, our care manager, our social worker in-house, and then you still get your full at least 20 minutes, if not more, just with the physician alone. So it's a big difference, a big change from other places I have worked.
Do they tell you that?
I've taken my family.
Do patients tell you that?
Oh, yes. Oh, yes. Patients that I've seen are so impressed with Oak Street. Even patients that are working with other people in our clinic, the care managers, they're coming out, they're doing home assessments, they're getting them equipment that they need at home. And it's so easy. Just let us know what you need, and we take all the steps and do all the paperwork for you. Same thing with insurance. Medicare is complicated. I'm a physician and I don't always understand Medicare. It's difficult to navigate. And we have people in-house at the clinic that help you with that.
Are there people, by the way, and I asked your founder the same question, and he said there's a lot of people that are, in their 80s or whatever, and maybe they don't have a lot of money, and they're not taking advantage of all that Medicare has to offer. Do you find that? I mean, there are a lot of people that just, like maybe they're underserved?
I find that across all panels, every community that we're in. I grew up in a middle-class community, people who have, money to spend with healthcare, have insurance plans, and do not understand it. So it's not just people that don't have insurance, it's people with insurance too. They don't realize all of the things that they can get from their insurance, that they can have dental care, that they can have vision care, that they can come see the primary care doctor. It's really unfortunate. I feel like in the United States, we've built a system where people go to the emergency room for everything.
But they go to the ER because they need to get in that day. They're feeling terrible. Can you see people the same day?
Absolutely.
Really?
That's what makes Oak Street so special. Every day of the week. We save slots in our schedule every day of the week, for people who have a problem. How many times have you called your doctor and they said, oh, well, we can see you in 2 weeks. In 2 weeks, you might not have that problem anymore. In 2 weeks, something very serious can happen to you. We will see people the same day, definitely within 24 hours. If we cannot get you in that day, you will be in the next day.
Are there a lot of people switching? That means they have a primary care physician. And
Oh,
are
yes.
they switching to Oak Street?
Absolutely. I see patients all the time that say, you know, this just wasn't quite right, or the staff at my physician's office were rude to me, or the doctor never called me back. They didn't get back in touch with me. I wasn't satisfied. And so they come over to Oak Street and they realize from this moment you walk into the door, our welcome coordinators are so welcoming. You're not a number, you have a name. We call you by your name. And they feel like they're part of the family. I mean, we have people that come to our community room in the mornings.
Now, what is this community room? What is this community room?
All of our clinics are very special. Each one has a community room attached to the clinic space. The community room is a space for our seniors just to feel like they have somewhere to go, that they can get out of their house, enjoy being there. We do have some classes.
Like
in
what?
fact, I've seen them do internet class teaching, because we do have free, or I should say computers set up, where the seniors can go ahead and get online, because a lot of them don't have computers in their home. We do classes. We have Zumba. One of the physicians teach salsa.
Okay.
I mean, it's just amazing the type of things that we have.
You ever get out there with them?
Absolutely.
So you've been out
like
there
to
dancing
dance.
with them?
Oh, yeah.
But how is it you're able to afford to be able to spend so much time with patients?
We are reimbursed through Medicare by keeping you out of the hospital. Reducing their admissions is what they call it. But in other words, instead of you going to the emergency room, being admitted for something that I could treat you for, I can give you an antibiotic in the clinic. I always ask our patients to call us first. Call me first. We leave slots open in our day so I can see you that day. Call me first. If it's something going on over the phone, our nurses will triage over the phone. And if it's something I can give you a medicine for, we'll go ahead and prescribe it that day. So we're keeping people healthy, bringing that back, and reducing the admissions.
This is not normal. This is not usual then.
Oh,
this kind of an experience.
I've never seen this anywhere else that I've worked.
What do you tell your colleagues, your friends, people that you went to medical school with?
I tell them that Oak Street is unique, is very special. I'm a family care physician and a geriatrician, so we all do primary care, and I tell them all the time, this is keeping the patients healthy. We're bringing primary care back.
You say it's cutting edge medicine. Is that right?
Yes.
You believe that?
Yes, I do. We're changing the way that medicine looks. We're changing what your healthcare clinic looks like. We're adding community rooms. We're bringing in a team of people to answer all of your needs. You know, what do you need at home? Do you need a wheelchair? We can get that set up and arranged for you. Do you want to come in and see your doctor? Do you need to talk about things? I'll talk with your family members. There's many days that I've stayed at work late doing family meetings because that's what's convenient for the patient. It's about putting the patient first.
Okay, so the big green vans that you pick people up in,
yes,
they're known in some of these neighborhoods.
People are now recognizing the green van. You can't miss it.
So they have to be eligible, you know, in need of a ride, but you'll pick them up.
Absolutely. Pick you up and take you back home. In fact, I have a patient that I think is a pretty serious patient. He's a pretty sick guy, and he didn't show up for his clinic appointment one day, and I was really concerned. I brought it up. Our clinic administrator hopped in one of our green vans, actually drove to his house to check on him and make sure that he was doing okay.
Really?
So the green vans are very
valuable. The family
valuable.
must be surprised as well when this.
Oh yes. She told me that his daughter was just amazed, floored, really. She couldn't believe it. She said she's never seen anything like that, just because he missed his appointment. And like I said, I was really concerned about him.
We're going to take a quick break. We come back, more about the process, like what happens on day one for a new patient.
Okay.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Follow the baseline. Come on, baby, shake it with a
You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new primary care experience that's focused on keeping patients healthy, and specifically today for people on Medicare. So what is the average age of your patients? I guess they have to be 65 and older?
So usually to receive Medicare, you are 65 years and older. So I see a lot of patients that are in their 70s, their 80s. We have a couple of 100-year-old too. But Medicare also has people that have disabilities as well. So some of my patients are a little bit younger than 65. But the big thing is if you have a Medicare card, we will see you.
Throughout the U.S., there's like these concierge medicine type of clinics, like $25,000 a year, and you get your own doctor. You could see them when you want. You get to spend like, an hour with them. But that's what you're doing with Medicare.
Absolutely.
I mean, is that right?
That's
it's
a
not
fair
an
comparison.
Exaggeration, right?
No, it's a fair comparison.
Because if they call you and need a prescription, you're there.
And
right?
if they call us and we think they need to come in and see the doctor, we're there. And we will still pick you up if you're eligible and bring you back home.
So there's a lot of people just using ERs because they put it off because they don't like their healthcare situation as far as going to doctors
or because they don't have a doctor. Where else do they go?
Are there a lot of people without a doctor at all?
Yes.
That could have a doctor?
Yes.
Assigned to them?
Yes, especially if you are a Medicare patient, you should have a primary care doctor. But a lot of people don't understand all the services available to them when they have Medicare.
You spend more time explaining solutions or explaining outcomes, or like diabetes you told me on the telephone, and patients are surprised at that.
I will say, I don't feel like I spend more time explaining things. I definitely want to explain things and have my patients be well informed. I spend more time listening to the patient. The number one complaint I have from my patients, their doctors don't listen. They walk in the room, they're on their computers, they're typing away, not paying attention to the patient. Sometimes they say they don't even really look at them. I spend my time, which once again is more time than any other clinic I've ever worked at, with that patient, listening to what is their complaints, listen to the things that are bothering them, and then trying to work together with them to find that solution.
Okay, so tell me about new patient experience. So on day one, what happens?
So new patient experience, you walk into the clinic, you see our welcome coordinator, and they tell you that you were here for your welcome visit. We don't even like to label it just new patient. You're already family when you walk in the door the first time.
Okay.
So we call it a welcome visit. This is your opportunity to look at us, meet the physicians, tell me about things that are going on in your life, things that are going on with your health conditions. And we discuss it together. I get to know you a little bit better.
Now you have an assistant there, I guess, in on the consult, and they're doing what? A scribe or something.
We call them scribes because they're kind of like a silent partner in the room. They're back there, they're the ones on the laptop, they're typing up the note, they're placing the orders, doing things that we've discussed, but I'm in the room actually engaged with you. I'm looking in your eyes, I'm reading your body language, I'm listening to what you're saying. Welcome visits are usually typically about 40 minutes with the physician. So we're not talking about your medical assistant in there or a nurse in there taking your vitals and going through your list of medications.
Okay.
No, we do that beforehand. Your first visit is a little bit long. I've seen people be there maybe up to 2 hours, but it's so important. You get to meet the entire staff, the whole team. You really get to see the clinic, and then you get to spend still 40 minutes with me as your physician. That's unheard of.
Are they surprised?
That's unheard of.
Because these are people in their 80s, oftentimes. I mean, did they tell you? I'm very surprised that you're able to spend this kind of time with me.
They are shocked. They're shocked. You're not going to come in. You're not going to just go through my medicines and sign some prescriptions and move out. No, I want to know about what's going on with you. I want to know what your living situation looks like. I want to know, are you able to drive? How did you get to clinic today? Did you come in one of our vans, or did you drive here on your own? Did you take the public transportation? I want to know about what your day-to-day life is like and how I can enhance that.
Now, your founder of Oak Street Health says that he really wants this to be the best part of their day, going to the doctor.
Yes.
Does that happen? Do they?
Yes, that happens.
So you believe that too?
Yes, people say that all the time. When you have your seniors, a lot of times they're at home, they're there by themselves during the day because, their other family members are working. This is a big event for them, coming to the doctor. And I want to make sure that it's everything that they're living up to. I want them to have, feel comfortable, feel like this is family oriented. I want them to be able to feel like they can speak comfortably with me. So it is a big deal. You know, they get to lounge in the community room, speak with other seniors. It's a big event.
The founder also said that it's almost like a hangout, this community room.
Yes.
That they
Which I
go,
like. I
they have
like that part.
coffee or tea or whatever.
We do offer complimentary coffee, tea. Yes, I want them to be able to sit there and enjoy, feel like they have a place in their community that they can go to and relax.
So I guess the main thing is this, that you're taking people that normally wouldn't go for their annual checkups, their mammograms. You're making it you're spending more time, you're making it a fun environment to get them involved in their healthcare and not just use healthcare as an emergency situation.
Yes, the biggest
Is that
thing
right?
is providing access. I want to be accessible to my patients. I want them to know that they can call me at any time. Even in the evenings, we have physicians on call 24/7, 7 days a week. I want them to know that they have access to us. You don't have to just go to the emergency room and sit for hours upon hours to get a prescription or to have a cough assessed. We can do that in clinic.
Okay, we're gonna take a quick break and we're back. We're gonna talk more about if somebody is hearing this and they wanna make the switch, how hard that is to make a switch.
It's not hard at all.
Okay,
We do most of the work.
Okay, so we're gonna talk about that when we come back. You're watching the Wellness Hour. I'm Randy Alvarez. We'll be right back.
Follow the baseline. Come on, baby, shake it with a little swinging. Nothing up and down, wait till the fun is coming. In 3, 2, 1, jump up and down. See the fun materializing. Jump up and down. Do the little spinning. Make it like you mean it. Jump up and down. See the fun materializing.
You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new kind of patient experience for people on Medicare. With us, we have one of the clinic directors from Oak Street Health, Dr. Frazier. Dr. Frazier, welcome back to the program.
Thank you.
Okay, so you say it is different. You have a team of people. You statistically spend twice as much time with patients.
Correct.
For those eligible patients that literally do not have a ride, you'll pick them up in your green vans.
Yes.
Drop them off.
Yes.
It's very unusual, and they don't have to pay for that. Is there a copay for the ride?
No, there is no copay for the ride if you're
Okay.
eligible as a complimentary service that we provide over at Oak Street.
Okay, so what if somebody already has a primary care physician, and maybe they like them, but they don't get to spend the time, maybe they don't like the team? It seems like it would be a hassle to switch, like medical records, etc. What's that process like?
You're referring to the physician breakup is what I call it. No one likes to go through a breakup, but you don't have to do it. We do all of the work for you. So if you like Oak Street and you want to stay with us, which I'm sure you will if you give us a try, we make all the phone calls for you. We go ahead and grab your records. There's nothing that you really have to do. We make it easy for you.
So you see patients, would you say, every week that did that physician breakup that are switching to you because their friend is using Oak Street?
Every
Health?
day. Not
Every
every
day?
week. Every day that happens.
Do they tell you, my friend said I have to come here?
Yes. We have a lot. In fact, I think that's our biggest referral pool is from other people. And that's the best referral that you can have. If you have someone in your senior building or a family member or a friend that talks about their physicians at Oak Street and how wonderful it is, those are the people that are coming in our doors every day and making those changes.
So they already feel like they've heard a lot about you, by the way?
Yes.
Like Dr. Frazier, you got to talk to Dr. Frazier? Is that right?
Yes.
Does that happen?
We do get that too. People come in specifically asking for me or one of our other physicians that are there just based off of a referral that they had from a good friend. So it's very important. We want to get the word out. I want you all to know that we are here and we're working for you.
And so friendly, that's big on the list of the founder. I've had him on this show. And he says these are handpicked, that he has like scoured the area, I'm paraphrasing, to find the best of the best.
I am actually
That are
helping
friendly
him with
first.
that.
That are friendly.
And that's very important. A lot of physicians are very smart and they're not personable. You've had people say, well, the physician's very good. He knows what he's talking about, but his bedside manner, that was terrible. We are looking for physicians and hiring physicians, and we already have excellent physicians that really care about the patient, building those relationships, really talking to you. So that's what we're looking for. Someone who I want my family to go to. That's what we're looking for.
But it is hard to have a relationship when you only have 5 minutes with a patient.
Well, that's why we have more than 5 minutes.
So you have the do you think that's your advantage? You have the luxury of being able to spend more time?
Yes. It's not about the number of people that we're seeing every day. We hold slots to see people when things are not going well for you. So we encourage it. We want you to come in. We spend on a first visit, our welcome visit, 40 minutes with the patient, and that's just the physician-patient time. You know, there's other time that you spend with our medical assistants or our care managers if needed, but 40 minutes alone with the physician.
You have a big emphasis on prevention, a lot of prevention. Like what?
We're primary care, and so a big part of that is prevention, going beyond just the typical mammograms, colonoscopies. I think most places do that, but I'm trying to prevent you from falling at home, making sure that your homes are safe. We do a lot of different things with you all.
So in a way, you're getting people back in the system, getting back in the, healthy, because this is when they need the help the most, right? If you're in your late 70s or 80s.
Yes, this is once you're 70s, 80s, we have some patients that don't have a lot of health problems, but I still want them to come in. I still want to see them and make sure that they're doing okay and that they don't have other questions or other ways that I can help them that they might not have thought of. But typically, when you see your average 80-year-old, they have a lot of medical conditions, but we welcome that. I like that challenge. And that's what
your
we
training,
do.
right? That is your training.
I'm a trained geriatrician, and so I'm going through all of your medicines and trying to get you off of some things if I can to make your life a little bit easier. You know, we're looking for preventing falls in your home, making sure that you have the equipment you need so you can live independently for as long as you can. This is what we're focused on. So even people that are healthy, we still want you to come into the clinic. There's still work to do.
I keep going back to my conversation with the founder of Oak Street.
Yes.
And he says, we hire people that really care.
Yes.
You think that's your competitive
I look for the
advantage there,
same
that you
thing.
actually
I'm looking
care?
for physicians that really care. And I like to say I'm one of those as well. It's a benefit for me. I'm so proud to work somewhere where I grew up. I'm treating my neighbors. These are people I know that and I love. And even the people that aren't my neighbors, I want them to feel like family. So that's a huge component. Not just the physicians, even the welcome coordinators, my nurses. We're a team, and everyone cares about the patient, and everyone treats every patient with respect. Like that's your grandmother, that's your aunt. That's what we strive for.
It's hard to believe there's more like you within the organization.
They're out there. They're
Is
out
that
there,
right?
and we got them. We got them. They're here working with us. That's the model that we're looking for.
So what is it people don't? So the Medicare patient that's watching this right now, what is it they don't know? What are their frequently asked questions? What are the misconceptions about Medicare that you can help people?
A lot of times people don't realize that you can have a primary care physician. It's almost a part of the culture just to go to the emergency room and get your needs taken care of. But it's so much simpler and easier to have a physician that you know that knows you and knows what to give you, knows what to provide, that will see you that same day. Oak Street is a very, very different place, but really all of healthcare should be that way. It should be about what's important to the patient and making sure that they have access to the care that they deserve.
So that's nice, though, the same day, because you say a lot of people wait.
Oh, yes.
A week or something.
I've called to see my own doctor or take my parents to the doctor, and she has a cold and a cough right now, and they're telling them, oh, we'll see you next week. That's the earliest we can get you in. That's pretty common. I think a lot of people have that experience. Yes, it frustrates the patients too. They come in and say that all the time. But with Oak Street, it's very different. If something's going on, we'll talk to you about it over the phone. I want to hear what's happening. I always tell people, call me. Even if you have the minor question, you're not even sure if we can help you with it, call us.
We are out of time, but you really feel like you're changing people's lives.
Yes.
Improving their lives.
Yes. Patients tell me this all the day. In particular, I can think of one person. She went through a really tough time seeing specialists. She had really terrible infections, ended up having a trach place, which is a plastic tube to help you breathe. She had it for years. The first time I met her, how long have you had that? Has anyone ever talked to you about removing it? no one ever told me it could be removed. She thought she'd have to live like that the rest of her life.
Wow.
Within months, we had her see the right people through her Medicare with just copays, no big surgical bills or fees, and she was able to have it removed. She says it changed her life. People stopped looking at her strange on the street.
That is interesting.
Absolutely. I mean, there's all these stories like that.
Give me another
many
one. Give me another
people-
one. We have time for one more.
There's a lot of people that didn't have a primary care doctor, didn't have access to care. They came to Oak Street and doing regular preventative screenings I would do for any of my patients diagnosed with cancers. We were able to find them early and treat them. If they hadn't come in, it could have been so much worse for them. But it ended up being a very positive thing. At Oak Street, even after speaking with the specialist, they still come into my office. They call in and say, I just need to speak with Dr. Frazier very quickly. And we talk about the risk and the hazards and the benefits of getting radiation or chemotherapy, helping them with a discussion, a conversation to make a good decision for them.
Wow. Wow. Good for you. And
It's
this
very
is
impressive.
Is this the future of primary care?
I hope so. I really do. I hope so. We need to bring primary care back. We need to take the focus back into the relationship with the patient, giving them a voice, giving them more control, and having a conversation about what's going on with their health, the things that are available to them, the options that they have.
Okay, good. So final message, somebody watching this, they're going, I've never heard of anything like this before. It is so hard to believe that they're going to spend that much time with me, that I'm going to have a relationship.
Then come on in. Give
Just
us
call?
a call. Give us a call. Come on in. Try it out. I hope you blow your socks off.
Okay, good.
I want them to come in.
All right. I want to thank you for coming on the show. Very,
Thank you
very
so much.
nice. Very nice. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.